Good evening. I'm seeing we have about 70 participants. Good evening, ladies and gentlemen. Welcome to our CME session today, hosted by the KMA Physician Wellbeing Committee. Today, we are truly honored to have Dr. Jacqueline Ochieng, a passionate advocate for holistic well-being. She brings a wealth of knowledge and experience in promoting a balanced lifestyle that nurtures both physical and mental health. In a world where stress and fast-paced living often takes a toll on our well-being, Dr. Ochieng will share practical insights and actionable strategies to help us cultivate habits that enhance our vitality, resilience, and overall happiness. Dr. Jacqueline Ochieng is a consultant psychiatrist with over 10 years of experience practicing at Gilead Mental Health Consultants, Menelik Hospital, and also at Mathare National Hospital, where she is the chairperson of the Employee Wellness Committee. She was the honorary vice secretary, then secretary of the Kenyan Psychiatric Association from 2014 to 2020, and participated in the development of the Kenya Psychiatric Association Strategic Plan 2019 to 2024. She also contributed to the development of the National Protocol for Treatment of Substance Use Disorders in Kenya, National Implementation Guidelines for Medically Assisted Therapy for people with opioid use disorders, the Mathare National Teaching and Referral Hospital Employee Wellness and Welfare Policy, and most recently, the Mathare National Teaching and Referral Hospital Performance Rewards and Sanctions Policy. She has a passion for adolescent and youth mental health, addiction psychiatry, and mental wellness at the workplace. Her desire is to help people overcome the hurdle of mental illness, achieve recovery, and maximize on their potential in order to achieve their life's goals. Dr. Ochieng is a mental health advocate and is dedicated to initiatives that reduce stigma and discrimination. She also is a dedicated mentor, nurturing the potential of emerging mental health professionals while shaping the future of mental health care in the country and beyond. She loves to spend quality time and create memorable moments with her family, traveling to new places both locally and internationally, outdoor activities to be in touch with nature, connecting with friends regularly, and she also thrives in art and music. She is a mental health advocate and is dedicated to initiatives that reduce stigma and discrimination. She's also a dedicated mentor, nurturing the potential of emerging mental health professionals while shaping the future of mental health care in the country and beyond. She loves to spend quality time and create memorable moments with her family. Please join me in giving a warm welcome to Dr. Ochieng as she takes the stage to inspire us with her talk on lifestyle for positive physical and mental health. Karibu, Daktari.
Thank you very much, Dr. Kogo, for that introduction. And thanks to the KMA Physician Wellbeing Committee for inviting me to make this presentation. And so I will just begin by sharing my screen. And so yes, I'll just go straight into the discussion. My outline will be more of definitions of what health and mental health is. I think these are some things that we repeat over and over again, but it doesn't hurt to remind ourselves. This being the second part of what we'll be referring to as lifestyle psychiatry, lifestyle medicine, I'll just give an overview of what it entails from both aspects. I would want us to just touch base on what wellness and well-being means. I'll delve quite a bit more on stress and burnout, and maybe just bring up the element of the Maslach burnout inventory, which I'll encourage us to take as a self-test and at our own time. Self-care cannot be overemphasized, and so I will just touch a bit on that. And then some of these insights that I picked from the most recent conference that I attended at the Kenya American Psychiatric Association, I was really interested in that aspect where we talk about the doctor being the patient and how do we take care of ourselves. And then also the nuggets of wisdom that I picked from that conference that I found quite interesting. And so I'm assuming that most of us are healthcare providers, and so we know the definition of health, which really brings out the whole the holistic aspect of health. Yeah, so health being a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. And mental health, according to WHO, it's a state of well-being in which the individual realizes his or her own abilities, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to his or her community. And so that's where the slogan, "There's no health without mental health," was coined. And so lifestyle psychiatry, just an overview, it's a subspecialty of lifestyle medicine that focuses on the prevention and management of psychiatric disorders through evidence-based lifestyle interventions, which complement these traditional treatments that we have, pharmacotherapy, psychotherapy, and even other aspects like ECT. So this emphasizes on the impact of factors like physical activity, diet, sleep, stress management, and social relationships on mental health. And so the approach really recognizes the interconnectedness of physical and mental well-being and aims to empower individuals to make positive lifestyle changes for better mental health outcomes. And so the key aspects really are evidence-based interventions, which really are research-backed strategies to address mental health challenges. It has a holistic approach, even from what I've just shared, having an interplay between the lifestyle factors and their influence on mental well-being. And it is complementary to the traditional treatments, whereby these interventions and modifications can be integrated with medication, psychotherapy, and other treatment modalities to enhance their effectiveness. Lifestyle psychiatry really focuses more on prevention and management, so aiming to prevent the onset of mental health conditions and manage existing symptoms through healthy lifestyle choices. And also the aspect of empowering individuals to participate actively in their self-management of mental health through their lifestyle changes. And so when we integrate all these lifestyle factors into psychiatric care, then this offers a comprehensive and empowering approach to mental health and enhances prevention and effective management of mental disorders. So this is more from the lifestyle psychiatry point of view. And just from that diagram, we'll see all the aspects that we're talking about. Physical activity, where we cannot overemphasize the importance of regular exercise, and this positively impacts mood and cognitive function. There's a healthy diet, where we really concentrate on proper nutrition. This is definitely vital for brain health and overall well-being. Restorative sleep, we'll be talking a lot more about sleep in subsequent slides, but it's important to realize that adequate and quality sleep is crucial for mental and physical restoration. Stress management, I'll delve a lot on that when I talk about stress and burnout. And so realize that mindfulness and meditation may help regulate stress and promote emotional balance. And we'll also have other aspects of self-care on matter stress management. Having healthy relationships is also important because strong social connections and support systems contribute a lot to mental resilience. And avoiding harmful substances, reduction or elimination of use of tobacco, excess alcohol, and other substances really improve our mental health. So from the lifestyle medicine aspect, this is one of the presenters that was there as a plenary session presenter, and he's really an authority in lifestyle medicine. Maybe when you have an opportunity, you can Google Dr. Dean Ornish, and you'll see a lot that he has been able to capture regarding lifestyle medicine, and now it has impacted positively on physical health. And so the element of diet, exercise, stress management, and social support comes out. And this can help prevent, manage, and even reverse some chronic diseases when addressed simultaneously with other conventional treatment modalities. And so, as I mentioned, it emphasizes the interconnectedness of the lifestyle factors and their impact on overall health and well-being. So a diet that is rich in terms of whole food and predominantly plant-based is really significant on matters, just taking care of mental and physical well-being. So fruits, vegetables, whole grains, and legumes should not miss in our diet. Minimizing processed foods, saturated and trans fats, and added sugars. And the benefits that have also been noted from research is that there's improved cardiovascular health, reduced risk of type 2 diabetes, and promotion of weight management. Regular physical activity where moderate intensity exercises like walking, swimming, cycling, and strength training can contribute a lot to our lifestyle and well-being. And this promotes cardiovascular health, wealth management, weight management, and improved mood. I'm sure those who participate in this regularly can attest to that. So as far as stress management is concerned, chronic stress is linked to various health problems. I think that we know. So meditation, deep breathing, and yoga can contribute to just alleviating stress. And this reduces anxiety and helps on sleep quality, improving the sleep quality. As far as restorative sleep is concerned, realize that when someone is deprived of sleep, it can increase the risk of chronic diseases. And so it's important that we prioritize sufficient and quality sleep. I don't know how many of us sleep adequately. I know sometimes you can use the excuse of being healthcare professionals, being on call. But when you get that opportunity to rest, I'm hoping that we are able to have, sufficient quality sleep. And so with that, really, the benefits are physical and mental restoration. Risky substances, abstaining from all these substances would really be the best option. But if one is already using, it would help to reduce the intake and especially excessive alcohol consumption. And this really cuts off the risk of developing chronic diseases. Positive social connections cannot be overemphasized. So if you have a strong social support network, this will definitely contribute to better physical and mental health outcomes. We realize that people who are socially isolated, their health, both physically and mentally, is negatively impacted. And so positive relationships really promote well-being. This is something that I picked up from the conference that I attended. And you can see the difference in the two trees. So when one is really, having an unhealthy diet, sedentary living, has chronic stress and social isolation, then they're really predisposed to a lot of conditions: heart disease, diabetes, type 2, hypertension, heart failure, elements of prostate cancer, stroke, breast cancer, obesity, autoimmune diseases, Alzheimer's disease, and even depression can result from that. And so if one is able to eat well, move more, stress less, and love more, you'll find that it's actually, they'll have a life that is flourishing like a well-watered tree. And so if we are to live from this webinar with anything, let us just be able to capture that aspect of eating well, moving more, stressing less, and loving more. So as far as wellness and well-being is concerned, I think we use a lot of these terms interchangeably, but it's really important for us to know that wellness is really a continuous and active lifelong process of making individual decisions to live a healthy, fulfilling life. So you cannot say you've achieved wellness. It's something that you need to continuously pursue. And well-being is a state of being that allows people to achieve their full potential. And so this brings in element of happiness, functioning well, fulfillment, and satisfaction. So we usually say that wellness is really the process or the day-to-day pursuit of attaining a sense of well-being, which is the result of our daily, wellness choices. This is a slide that just captures the different aspects of wellness. And so we have emotional wellness, I'll not go into the details, but it would be good for us to just take note that there are 8 components of that. Emotional wellness, environmental wellness, intellectual wellness, physical, which I think we concentrate a lot more on. Financial is very important, and I know it contributes a lot to just our mental well-being. Social wellness and spiritual wellness and occupational. So these slides will be shared, or you can be able to access them to be able to just find out how do you fare in these various aspects of our lives. So I'll go into stress and burnout more in detail, because these are things that many times we find ourselves overlooking. And I know a lot of presentations have been done before, but for the purposes of this presentation on matters lifestyle psychiatry, I will just go into just some explanations. So stress is a complex series of the body's reactions, both psychological and physical, in response to demanding or threatening situations. While burnout is a state of emotional, mental, and physical exhaustion caused by excessive and prolonged stress. So by the time somebody's talking about being burnt out, it's really something that has accrued over a period of time. And so it's important that we take note of some of these signs and symptoms, which I'll share subsequently. So it's a triad where one presents with emotional exhaustion or depletion. So someone will actually feel fatigued most of the time, no energy to do anything, and generally feeling overwhelmed. And then the element of cynicism comes in, where one is, which we also refer to as depersonalization. One is detached towards their work or their colleagues, and you'd find that they're emotionally numb or indifferent towards others. And then professional efficacy, one feels like there's a reduced sense of personal accomplishment, despite all the accolades they may have besides, their name and their titles. One will feel that they have low self-efficacy, a sense that they're not making any significant difference in what they're doing, and some sense of incompetence and effectiveness may also come in. So stressors are really events or situations that produce physical and psychological demands on a person. We'll see some of this even as we talk about the causes of stress. I think from maybe a background, we've always learned about the fight or flight response. So when one is threatened, the body's nervous system will release a flood of stress hormones, which include adrenaline and cortisol to rouse the body for emergency action. But usually what happens is when one is in a chronic state of stress, then the body finds itself in a state where it's always, in an emergency state, which is not good for one's mental and physical health. It's good to realize that moderate levels of stress are actually good to help improve our performance and efficiency. It helps us stay focused, energetic, and alert. Now, when one is in a situation or in a workplace or a setting where there's not much stress in that sense, it might result in boredom, which is also counterproductive in their work setting. But too much stress may cause an unproductive anxiety level, which may cause damage to one's mind and their body. So these are some of the effects of stress overload. It affects every aspect of one's body. So from the physical, where one will present with all sorts of aches and pains, some change in bowel behavior, nausea and dizziness. Sometimes there's a chest pain or increased heart rate, a loss of sex drive, and frequent colds and flus. It would be important to take note if you find yourself in such a space. Behavioral, one may find themselves eating more or less, sleeping too much or too little, sense of isolation, using substances either to relax or to cope, and sometimes even some nervous habits might crop up. With cognitive symptoms, one might actually have poor concentration, memory issues, poor judgment, mostly seeing things in the negative, anxious or racing thoughts, and constant worrying. And the emotional aspect, then somebody present with moodiness, irritability, or short-temperedness, being agitated, feeling overwhelmed, being lonely, and just feeling a general sense of unhappiness. So I'm not sure whether some people may identify with this, but it would be important to take note when such feelings or symptoms crop up. So the external factors or causes of stress, major life changes, marriage, transfers or promotions can contribute to this. Sometimes work or school, relationship difficulties, financial problems, or just being too busy. Children and family might also affect us in this. Internal sources of stress would be chronic worry, pessimism, negative self-talk. Some people may have this sense of perfectionism that might actually cost them, their sense of peace, and being rigid or having an all or nothing attitude. So I'd want us to take maybe just a short time to just answer a yes or no. It's gonna be very quick. So this is really how well would you handle stress in your life? So someone would say, I have people I confide in when I'm feeling under pressure who make me feel better. So is that a yes or a no? Maybe just take a mental note of that. I feel more comfortable expressing how I feel when something is bothering me. Are we in that space where we can express ourselves? Then in general, I feel in control of my life and confident in my ability to handle what comes my way. Yes or no? And number 4, I find reasons to laugh and feel grateful even when going through difficulties. Is this a yes or a no answer? And no matter how busy I am, I make it a priority to sleep, exercise, and eat right. The 6th one would be I'm able to calm myself down when I start feeling overwhelmed. So I don't know how many yeses you've answered and how many no's you've answered. But the more your responses are in the affirmative, it represents an important stress coping skill. And each no answer represents an area to work on to become more resilient. So improving stress tolerance, I think I already talked about this. I will not really go into detail. And those are what I presented as introduction to lifestyle psychiatry. So when this comes out, it makes us realize that these things cannot be overemphasized. So supportive network, exercise, diet, having a sense of control. When you're confident in yourself, it really improves your ability to influence events and persevere through challenges. So it would be good to start developing some of these positive aspects. And then an attitude and outlook of life. When people are more optimistic, then they'll be more stress hardy and embrace challenges. Having a strong sense of humor and accepting change as part of life. So ability to deal with one's emotions is also important because it helps one bounce back from adversity. Then knowledge and preparation, usually what I say is that if you're going for an interview or you're going for a procedure or something, if you prepare yourself well enough, it actually reduces the anxiety or stress levels that may come with whatever activity you're to do, and it makes it so much easier to cope. So as far as work is concerned, I think a lot of us may identify with this, and so I hope that over time, some of these situations at the workplace can be sorted out. So when one has to work overtime due to staff shortage, sometimes having pressure to perform to meet rising expectations, but there's no increase in job satisfaction, this can be a stressor. Pressure to work at optimum levels all the time. In some cases, people might work where they have a fear of being laid off. And settings where there are contracts or renewal of grants, if one is uncertain about that, that can also contribute stress. So it's important that we are self-aware to recognize some of these signs, which I already shared before. Taking care of yourself, I think I've already said that. And on top of that, being able to have somebody that you can talk to and just listen through some of the challenges that you may be going through. And bad habits, sometimes people can be too towards perfectionism, not having a sense of punctuality, having negative thinking, or trying to control the uncontrollable. It would be important for us to realize what we're able to do and just create boundaries around that. Time management is important. Sometimes also, as far as tasks are concerned, we need to prioritize our tasks and break our projects into small steps to delegate responsibilities to other people. Emotional intelligence, I think those are some of the aspects that we usually talk about. It's important to be able to, sorry about that, to be able to, sorry, is my slide there or it has disappeared?
It's there. You can continue.
Oh, okay, it's there. Thank you. I'll switch off the video a bit. I think it's disappeared on my side. Okay, sorry. Yeah. So being able to prioritize tasks and breaking projects into small steps, delegating responsibility and being willing to compromise. I talked about emotional intelligence. So when you're stressed, you'll be able to recognize that and do something about it. And also the nonverbal cues and body language. We also need to learn how managers or employers can reduce job stress by improving communication, consulting employees, and cultivating a friendly and social environment at the workplace. I don't know why the slide doesn't seem to be moving now. Sorry. I don't, it's stuck. I don't know what I need to do to. Let me just stop and then I get it back on. Okay. Okay, so I think we can continue. Sorry about that. I don't know that Dr. Kogo, you can assist me beyond that. I'm feeling like it's not moving.
You're still not able to move from that.
Oh, I don't know. It
Now
has
we
moved.
can. It has
Oh,
moved
okay.
now. Yes.
Yeah. Okay, thank you. Okay. Okay, now it's moving. Thank you. So, burnout, this is just to just help us see what burnout generally looks like. Okay, it's not showing again on my side. So I usually what you see on the outside is really probably a cover of what's going on the inside. And so you realize that when this burnout iceberg shows us, when somebody is irritated or they're on the edge, they are spaced out, or maybe they seem to be scattered in their mental thoughts, you may not know what is going on, in terms of worry, having intrusive thoughts, an element of shame, being embarrassed or panicky, guilt, not sleeping well, concentration difficulties, and that kind of thing. And so it's important that we are also aware of ourselves. And as I said, in your own free time, maybe you can just do your own self-assessment, the Maslach burnout inventory, and just see what is happening on your part. Okay, slides are now not moving. So okay, I don't know, maybe I can be assisted in terms of just sharing the rest of it, because it's not, I don't know why it's not responding.
That's okay. Let me try and project on my end.
Okay, let me just stop. Do I have to stop this, right?
It's okay. I'll just share.
Okay. Sorry about that. I can see somebody is talking to me and telling me that sleep is overrated. I don't know how many of us feel that way. Thank you, Doc. Maybe we'll just move to that slide for burnout. Are you able to scroll to the...
Yes, let me just put it on SlideShare, then I will scroll.
Okay, thank you. So even as that is being done, I may just continue with the discussion. So some of the signs of and symptoms of burnout, you'd find that the physical signs and symptoms, one will be feeling tired and drained at most times. There's a lowered immunity that comes with it. Somebody is always falling sick, and I think it presents itself mostly with abdominal symptoms and colds and flus. Having frequent headaches, back pains, and muscle aches. Yes, thank you so much. And then changing appetite and sleep habits. The emotional aspect of burnout, when one presents and feels a sense of failure and self-doubt, feeling helpless, trapped, and defeated, detachment or feeling that you're alone in the world, no motivation, having a negative look towards life, and just a decreased satisfaction and sense of accomplishment. So what you'll notice presenting behaviorally is that somebody will withdraw from responsibilities, they'll isolate themselves. One may keep procrastinating, be it in terms of work that requires deadlines, or maybe if they need to have meetings and they're always postponing. Sometimes people will use food, drugs, and alcohol to cope, and taking out their frustrations on others. Then this might end up translating in skipping work. Somebody will show up to work early, late, and leave early. What we'd probably want to be referring to either as presenteeism or just overt absenteeism. Moving to the next slide. And so the red flags of burnout, it's basically a pictorial representation of what I have shared. And of importance is to take note of what we have on the left side, whereby you do not wait until the battery charge is at, extremely low that you take a break. So when you're self-aware, then you'll be able to take a break at the right time. So the causes of burnout, in the next slide, it's some of the work-related causes. Really, when you have little or no control over your work, sometimes people work and they don't feel recognized or rewarded for what they've done. This can actually contribute to burnout. Not having a clear, expectations at work, or having an overly demanding job can contribute to burnout. Sometimes when you find yourself doing the same thing over and over again over the years, it actually can contribute to burnout. So sometimes it would be good to even just change stations or change departments to be able to feel accomplished. And working in a chaotic or high pressure environment can also add to that element of burnout. Sometimes we have the lifestyle causes of burnout, where when you work too much without enough time for relaxation and socialization, it can contribute to that. I don't know, maybe as medical health or health professionals, what happens when it comes to certain disciplines that require a lot of our attention. It's important that we are aware to take breaks. Maybe during the session, during between our working schedules, or even just taking leave officially. Sometimes one is expected to be too many things to too many people. I think we need to have boundaries and learn to say no. Taking on too many responsibilities without enough help from others it would be important that we also see how we take care of ourselves, not getting enough sleep, or lack of close and supportive relationships. I think when you see some of these things, you realize how the element of lifestyle psychiatry just weaves through all this. Then there are certain personality traits that may predispose one to burnout. Usually the type A personality who really are perfectionists and are more of, no nonsense and all or nothing kind of people would find themselves more predisposed to burnout. So I think it would be important that even if we are this kind of personalities, we learn how to strike a balance. And sometimes needing to be in control or not wanting to delegate work can also contribute to our own downfall. So the next slide shows really a comparison between stress and burnout. And you really would not want to get yourself to the point of burnout. But it would be good to know that when one is stressed, then they'll be finding themselves really over-engaged in what they're doing. While burnout, now somebody just feels nothing about whatever they're doing, which is really a bad thing. With stress, there's an emotional overreactiveness, while with burnout, one is really emotionally blunted. Stress really produces a sense of urgency and hyperactivity, while burnout makes one feel helpless and hopeless. With stress, we have a sense of loss of energy, but burnout is really a loss of motivation and ideals. Stress may lead to anxiety disorders, but when we talk about burnout, we might find ourselves in detachment and depression. So the primary damage as far as stress is concerned is physical, while in burnout, it's emotional. While stress might kill you prematurely, burnout, somebody would end up living with a sense of life feeling like it's not worth living. And so the next slide will be talking generally on prevention of burnout. And these are some of the things, I don't know whether you can see some of this, but I think they're things that we are very aware of. So all I'll be doing is just reminding us on what we need to do. Just having a relaxing routine, you taking care of your physical well-being in terms of what you eat and how you exercise and sleep, having boundaries, and just taking daily breaks from technology. Last week we talked about the technology and everything that goes with it. I think it is important that we realize that some of this can be really causes of stress and burnout. Nourishing our creative side, I believe we each all have hobbies or things that we love doing. So it's important to do that as well. And learning how to manage stress. And this is really why we have some of these sessions so that we can be able to have or regain our balance. And you need to remember that self-care is not selfish. So the next slide talks about sleep. Somebody said that sleep is overrated, but I think it is important for us to just assess and check on ourselves. So maybe just ask yourself, when was the last time you slept for 7 to 9 hours continuously? Of course, people might feel 9 hours is a luxury. 6 to 7 hours perhaps would be adequate for a restoration of a physical, and mental health. Is there a point where you actually sleep continuously and wake up refreshed? Do you go to bed at the same time and wake up at the same time daily? Is your sleep refreshing and restorative? And the last question would be, does there come a point where you'd have to use substances or alcohol, or pills to fall asleep? So those are really red flags when you get to that point. But it's important to practice elements of sleep hygiene. And I think that one on the slide just shows everything that you may need to do. And I will not overemphasize that. As far as diet is concerned, do you have a healthy diet? I think I already shared that in the beginning when I was talking about what kind of foods you need to eat. So it would be important for us to take note. This is a slide that I picked from the conference I attended. And it's interesting how diet, the interconnection between diet and depression are coming. And some of the results showed that diets that are higher in whole plant-based foods are associated with decreased risk of depression. And so it's important for us to really take note of that. So when you talk about recovery, as far as burnout is concerned, I know self-care is one of the issues that you can discuss, but sometimes it would be important to literally take a break, just cutting down on activities and commitments that you may have, overcommitted yourself to, getting support, reevaluating your goals and priorities. So when one gets themselves to a point of burnout, it's really a sign that something important in your life is not working. And if it's at work and there are certain circumstances that maybe predispose you to that, it would be important to address some of these issues. Be proactive about it and don't just be resigned that I'm doomed to be in this place and suffer. Sometimes it's also important to clarify your job description because you might find yourself doing too many things that are really beyond what your scope of work is supposed to be. And if you feel you've been doing the same duties for a long time, sometimes it helps to just change environment or change stations. And taking time off, don't let yourself have to get a sick off or a sick leave to allow you to say that you're going to get to rest. So remember what I said in terms of the battery charge. Don't wait until it is red for you to now take a break because it will take you much longer to recover. And sometimes even taking the temporary leave of absence would be important. And so the next slide will show us about mental health. And we really realize that from positive mental, well-being all the way to mental illness, it's really a continuum. And sometimes you might not realize that you're finding yourself to a point where, it would be overtly mental illness. What we're talking about maybe most commonly being anxiety, depression, and perhaps maybe for other aspects where there are predispositions genetically, when overt symptoms are presenting, then would be probably, it would cost us more. So with lifestyle psychiatry, we're talking about prevention and also incorporating some of these things in our health. So I'd rather we take care of ourselves than find ourselves at the end of the continuum. And so really what happens then if one finds themselves in a space where they are unwell, they've been diagnosed with a mental, disorder or an illness, we get to realize that some of the common mental health conditions, physicians not being, excluded from this, are suicide, depression, anxiety, alcohol and other substance use disorders, and bipolar mood disorders. This quote, I also picked it from the conference I attended, and it was a quote from Dr. Ananta Dave, saying that not only are medical professionals at higher risk of suicide than the general population, but they also disproportionately suffer from the stigma of seeking help. And I think a lot of us will identify with that. We have a lot of reasons for not seeking help. And so I'm hoping that some of these expositions and sessions we have help us self-reflect and be able to know where we can get help. The next slide shows us that when, physician suicide being something common, and especially amongst females, female physicians and female non-physicians, and realize that physicians are more likely to have a depressed mood, other mental health problems, job or legal problems than non-physicians. These are some of the presentations that were made during that during the conference. Depression being a significant risk factor in suicide deaths. And it was really found out that the physicians who took their lives were less likely to be receiving mental health treatment compared to the non-physicians who took their lives. And so you realize that if somebody is not self-aware to the extent of seeking help, then they'll be more predisposed to some of these unfortunate events. Women physicians suicide, the next slide, was discussed at length during that presentation, and we realized that a lot of factors that may be against the women usually would be disparities in work and family role tensions. Realize that at home you're still expected to be the mother or the wife, and at work you still have to take care of all your responsibilities. Elements of sexual harassment sometimes come up. Then there's intersecting identities where, as a woman, you want to try and really prove that you can do so much, but that also results in, tendencies towards suicide. The inequitable pay gap, I don't know how it is really in the Kenyan situation, but sometimes you'd find that there are disparities, and women probably, as much as they work equally hard, may get, paid less. The elements of, mental health and limited engagement in treatment. And so these are some of the things that once they come out, it's important for us to be able to take note. Alcohol use disorder amongst healthcare professionals. I know these are some things that we may not necessarily be talk about openly, but it is important to realize from the sessions I attended, it was found that from the research done that alcohol is the #1 substance used by medical students, residents, and physicians even after the training. And symptomatic drinking is a frequent precursor to alcohol use disorder. Binge drinking was the most common amongst trainees compared to the daily drinking in physicians. So I don't know which categories we find ourselves in, but maybe this is also an opportunity to reflect amongst ourselves and what our habits really are for coping. Very few trainees and physicians self-report because there's an element of, they'll deny or minimizing. Sometimes there's a fear of repercussions to training or career trajectory. There's also shame and judgment. But it's important for us to note that some of these things happen, but help is also available. And so sometimes when we work with colleagues or maybe, in the mental health field, it's important. Sometimes we'll have challenges in just trying to get accurate or honest self-appraisal. It's important to have collateral information, but sometimes, at the workplace, maybe a supervisor or, somebody who is a senior might want to report. You'll find that you need to be careful against issues of collusion or just being enablers. Rationalization and normalization of a drinking culture in medical training and beyond, I think, also contributes to the challenges for us to be able to make an objective assessment. As far as therapeutic alliances are concerned, elements of transference and countertransference may happen, and so it might take time to build a rapport, and sometimes it might be on and off. And sometimes denial and lying, come out very commonly. And so sometimes when you have colleagues, especially the junior clinicians, caught in this space, it would be hard to accept, some of these issues without feeling judged. And we are all aware that addiction is a disease, and sometimes we might find that disparity of whether to, handle it as a disease, or sometimes people will want to take it as, a disciplinary issue. And so with the next slide, you're talking about impairment. It was interesting to see this being some of the factors when you're talking about fitness to work. And so you realize that physician impairment refers to an inability of a physician to provide medical care with reasonable skill and safety due to illness or injury. And so the illness is not equated with illness is actually not equated with impairment. But impairment is usually found when an illness that requires treatment exists. And so some of this might range from mild to severe. And so you might find that a physician may be impaired in one dimension of their work, but not another. And some of these things, it's important to take note of this, because when one would want to render somebody, a colleague, not fit to practice, it would be good to go through the whole aspect of impairment. The next slide. Stigma comes out very strongly, especially when we come to, a doctor being on the other side of, the divide as a patient. A survey of over 2,100 physicians who met the diagnostic criteria for a mental disorder revealed that 50% were reluctant to seek professional help because of fear of stigmatization. And so I may not go into all the details of what stigma is about, but if you're able to check the research or the document done by Thornycroft et al. 2022, you'll be able to get all the details on matters stigma. But one of the issues that came out as far as handling or challenging stigma is concerned, yes, being educated is okay, protesting against it is okay, but social contact is really one of the most effective ways of reducing mental health related stigma in adults, which also subsequently would mean amongst our colleagues. And the next slide shows that some of the things that we may want to address. There's a Lancet Commission. Whatever is showing there might not be very clear, but if you also Google that, you'll be able to see some of the ways of trying to end stigma and discrimination in mental health. And so it speaks to everybody, from the governments and policymakers to international organizations, employers, healthcare providers, media organizations, and people with lived experiences. All these people need to be incorporated on any initiative that may want to end mental health stigma and discrimination. So I think that would also be a good thing to look out for. So there's also something that came out that I found very interesting on matters disclosure. So when an individual is living with mental illness, and especially from the mental health or the doctors or physicians in that sense, some of the quotes I found there were like 91% of respondents agree that knowing physicians further along in their careers who struggled with mental health issues and got treatment and were now doing well, this would make them more likely to access care if they needed it. And so that was just an element of people sharing their experiences. There's a psychiatrist who also shared her experience, Dr. Claire Polkinghorne, who said that as a psychiatrist, I had hoped that I was pretty good at empathizing with my patients. However, the last 9 months of my life has taught me more about mental illness than years of clinics, ward rounds, home visits, or reading psychiatric literature. And so it's really a balance to disclose or not to disclose. And so some of the things that I presented in this slide are really the pros of disclosure are it builds rapport and trust. Patients would feel more understood and connected, and it improves therapeutic alliance. It also helps on matters destigmatization, where sharing lived experiences can normalize mental health struggles, reducing shame among patients and the public. It also would promote advocacy and education, whereby somebody would present as authentic and credible. And this really humanizes the doctors, reinforcing that mental illness can affect anybody. It also encourages help seeking, hearing that even healthcare professionals can face challenges. This may motivate other people to seek care, and it also has a human connection aspect to it. But some of the disadvantages that may come up are, blurring professional boundaries, where sometimes the focus now may shift away from the patient and perhaps to the doctor. There may be a risk of dependency or enhancing transference, risk to professional credibility, because you know that sometimes we probably not at a high level on reduction of stigma and discrimination. So some people may actually question a doctor's objectivity and competence, and sometimes it may compromise privacy and vulnerability, and the potential for stigma and discrimination. Especially maybe licensing institutions who hold biases against doctors who disclose their lived experiences. So I'm hoping that we can, go steps ahead to be able to incorporate some of these things. So sometimes it may open the doctor up to scrutiny, judgment, or even threats. And so when one is considering disclosure, the best practices really are to be purposeful. One needs to be selective and appropriate. One needs to be comfortable with the story and know the audience. And so something I also found interesting from that presentation was that, depending on one's stage in their career, it was found that younger doctors, if they were to self-disclose, then you'd find that there may be greater discrimination and stigma, or risking the element of oversharing with patients. But for maybe older doctors, may find that they can be able to capitalize on their professional successes, and their prior career achievements can protect them from retaliation and stigma. And I find that doctors who disclose personal and family histories at later stages of their career may actually feel less vulnerable. So in the next slide, this is just more of a reflection. I do not know what we have in this country, because from the conference that I attended, we were challenged and we're trying to wonder, do we have these programs? I appreciate that KMA has the well-being committee, but do we have employee assistance programs in our institutions? Or how are we navigating this, especially when we got these guidelines on workplace mental wellness? I'd throw this challenge back to us or to KMA. or whoever it is that, finds themselves as a stakeholder. But the quote that I found quite intriguing was that those who love you are not fooled by mistakes you have made or dark images you hold about yourself. They remember your beauty when you feel ugly, your wholeness when you are broken, your innocence when you feel guilty, and your purpose when you're confused. And so it's important to surround, yourself with people that would believe in you no matter what challenges you may, just come across. And so in the last slide regarding the doctor being the patient, it's important to note, that clinicians wear many hats. And so these multiple roles need to be navigated, especially as we take care of ourselves and take care of our colleagues. Stigma and the consequences of stigma. It's important because physician patients fear professional fallout around substance use, suicidality, and perceived impairment from untreated or undertreated psychiatric illness. Fragile trust in closed systems. So confidentiality must be fiercely protected when trainee patients and their treating psychiatrists share institutional space and overlapping relationships. And monitoring and reporting is important. The duty to identify impairment in physician colleagues must be balanced with preserving therapeutic alliance. And the assumptions and mistrust that go with, the element of mental illness. So it's important that, sometimes that trainee patients often hold assumptions about what their clinicians will disclose or what they know. And so it's important that even as we take care of ourselves and take care of each other as far as colleagues are concerned, we are able to protect each other through this. So as I'm winding up my presentation, the last two slides are some of the things that I just picked from the Japanese. We were able to interact with some of the members of that association from Japan. It's amazing that in Japan, they have the highest number of people who are above 100 years. As at 2022, they had almost 90,526 people. And so we're just wondering what is what is their secret? And some of these things came out. I don't know whether we've had that concept of Ikigai. That one I'd leave it upon ourselves to find out. There's a whole book about it. It's not a really big book, so if you can read through it, you'll probably be able to find, some meaning. But the last slide, which is the last but not least, just brings out the aspect of, the 5 key elements of well-being, where psychological well-being is emphasized, having positive emotion, where the element of enjoyment, interest, inspiration, gratitude, and hope. Just being engaged in the things that you do without when you enjoy what you're doing, you actually find that time really flows and you enjoy yourself. The element of finding meaning, relationships are important as well. And the positive psychology aspects, we need to build resilience. We need to, embrace optimism, self-control, self-efficacy, positive attitude toward aging. I don't know what usually happens, what comes to our minds when you talk about, retirement. Element of spirituality, wisdom, and altruism. And the lifestyle habits for preventing cognitive decline, I think those are some of the things that I embrace to prevent, losing as when they're aging. We have enjoying good food, but I don't know to what extent we usually eat, but they're saying that eat your food until you're 80% full. They talked about taking alcohol in moderation, but if one can avoid, that's even better. Keeping on moderate exercise regularly, good quality sleep every day, staying connected with the people around you, living happily with small joys, maintaining a positive mindset, and enhancing your cognitive reserve. And so that is really what I would summarize my presentation with. And I can hand it over back to Dr. Kogo. Thank you.
Thank you so much, Dr. Ochieng, for this timely and really important discussion today. I believe everyone has gained a lot. I know we have a couple of questions that we might need to address. So let me just get into that. Oh, someone was asking, what's the best drug for insomnia?
Wow, best drug for insomnia. Now, insomnia is a symptom, if you ask me. And so by the time somebody is talking about insomnia, I think that the most important thing would first be just try and assess the person and find out what is really causing this. Because sometimes it can just be, it could actually be a presentation of an underlying mental condition, maybe like depression, anxiety, amongst others. I may not say best drug per se, but when one is assessed, then we're able to figure out what is happening. If you're assessing for depression or anxiety using, the scales that are there, and you find that, then if we treat the depression and the anxiety, the insomnia will probably, be resolved. But what I've just shared in terms of lifestyle, sleep hygiene, those are things that one would want to embrace even before we are thinking about medication. But if it's something that's been persistent, it is important to seek professional help to be able to figure out what is the cause and address the cause for that.
Okay, so Christine Gadiri is asking, can one have both stress and burnout at the same time?
I would say I would not say having both at the same time, but really it's in terms of the same way I said there was a continuum as far as mental illness is concerned. It can start off as stress and eventually end into burnout. And so if you feel that you find yourself falling in one of those categories, as far as burnout is concerned, there's what I mentioned, the Maslach burnout inventory. It's available online, so someone can actually just do their own self-assessment and see if they really meet that threshold to be called burnout. And so that would also have a more intensive way of managing compared to stress, which what I'd shared earlier on stress management are factors that you can actually put into place very easily. Yeah. So I'd say maybe if you really, really want to figure out, is this burnout, then doing the self-inventory, Maslach burnout inventory self-test can also help to be able to demarcate and the degree to which that is. Yeah.
Okay, thank you. So Christine also says thank you for the great presentation. And we have a question from Professor Paul. And he's asking, he's saying, very interesting lifestyle talk. How do we distinguish between addiction and recurrent necessity for things like alcohol or food types? Let me just scroll again. I see that, well, can one be said to be addicted to certain foods?
Okay. Now the term addiction, I think many times we use the term addiction very loosely. When you find yourself maybe just predisposed to certain behaviors, but addiction in itself is when you talk about maybe to substances or that kind of thing, you're talking about a disease a brain disease in terms of your body has been wired to seek, to find itself, seeking, how would I put it? When you're talking about dependence and tolerance, you're talking about now substances, but a certain love for something, I wouldn't call it to that extent addiction. And so it would be important to take, to make a difference between that. But sometimes people might find themselves, maybe we're talking about comfort eating in the element of maybe depression and that kind of thing. But when we're talking about addiction, we have DSM-5 criteria that we need to fulfill to be able to say that this is what it is. But there are different types of, like maybe substance, food, behavioral addiction. So it's to meet that criteria, then that's why we'll be able to say that that is a diagnosis that has been made specifically to that. But I know many times we use that term very loosely, and so we need to be careful about that.
All right, Doc. So many people are thanking you for the great presentation on the chat box. So let me ask you one question from Jen Rose Ambuji. She's asking, what is the minimum number of hours one requires to sleep daily to remain healthy? And then we have another question from Dr. Diana Marion. She's saying, she's saying, comment about premenopausal age and mental health. Then now I'll ask you another one.
Okay. Oh, now, when it comes to premenopausal and mental health, I may not be an authority in that. I don't know whether any of my colleagues are around, those especially who are interested in reproductive health, to maybe say something on that. I think that's a whole topic in itself. Maybe I'll challenge you back as KMA Physician Wellness to probably have some expert to talk about that. But as far as sleep is concerned, then we'll be talking about 7 to 9 hours of sleep. Of course, sometimes people feel like 9 hours is way too much, but there are other people whose bodies thrive in that. By the time you're talking about 6 hours, we are probably just trying to push it. Anything below that will not be restorative and may not be helpful as far as, just your body, physical and mental health and restoration is concerned.
Okay, so Fauzia Bat is asking, do you offer cognitive behavioral therapy for menopause related issues?
Wow, menopause again.
Mhm.
I believe there's a whole way of there's a whole management protocol regarding that. And so if I have colleagues who are interested in that aspect, maybe they might answer. I don't know whether we have any that is on the call. Um, but then again, I'd say if we can have another session to just discuss that, maybe from the experts, I think we'll be better informed in that aspect of
Okay.
menopause, perimenopause, and all that. Yeah.
Okay, so I'm seeing two people have raised their hands. Semberege Farouk, are you still with us? Would you like to speak? But we will have to add you to be able to. Okay, yeah, he's dropped the hand. Then there is Joseph Mwangi. I'll allow you to talk if you're still with us. Can you unmute yourself, Joseph Mwangi? Okay, so let's go to another comment. Anonymous attendee says, thank you for the presentation. I feel, however, that hypersomnia is not given as much attention as insomnia is, yet it can be as debilitating, sleeping many hours but not quite feeling rested. Then again, another anonymous attendee, thank you for the presentation. Medical training and practice generally requires a lot of time. Is there a maximum number of hours that a doctor in training or practice should work in order to remain safe?
Okay, so maybe let me just comment on that. Yes, somebody talked about hypersomnia. Now, when you talk about insomnia or hypersomnia, sometimes this presenting itself as a symptom of maybe another underlying mental illness. Yes, I think I shared some of the presentations of maybe stress and of stress and burnout being either sleeping too little or sleeping too much. And some of these also overlap with depression. But it's also important to note that there's a whole, chapter also on sleep disorders that we are definitely not able to explore in this session. And so that would be something else that can be tackled. Just having a talk on sleep disorders to know to what extent are we talking about hypersomnia and to what extent is it debilitating to an individual. But if it is a symptom of depression or stress and burnout or even underlying maybe anxiety or so, it would be important to address the primary cause of a problem, and you'd find yourself at least some of these things being addressed. Yeah. So
Okay, so
as far as training is concerned, now I think those are some of the things that came out from, research that has been done. I may not be able to recommend how many hours that somebody should be working. I know many times we say 40 hours, in a week or that kind of thing. Some of it may translate to overtime. But I think we are all aware of how, rigorous the medical professional training is. Maybe what I would say is that I also attended a session that they were talking about modifiable factors on matters depression, and it really was about residents and how some of these things affect their mental well-being. And so for sure, issues like, work hours, sleep, diet were things that you can modify as opposed to what may be genetic predispositions. And so I feel that if we are aware of this and we have the research to back it up, then we need to be able to make the necessary adjustments to have working hours that are conducive for everybody. So that then we are not, raising people who are predisposed to mental illness in the future. That would be my take. Thank you.
Prof. John Adwok says, just to say this was an excellent presentation, a lot more of the appreciation messages in the chat. So I don't see any other question. At this point, allow me to introduce to you the KMA. Just hold on, let me see if he's still here. Yes. Oh yeah, we have the Secretary General and also the President, Simon Kigondu. We can start with the KMA Physician Committee lead, Dr. Ida Wanjiko, and then she will introduce the others.
Thank you, Dr. Kogo. Great presentation, Dr. Jackie. We've also heard that you've challenged us to do a few things, so we will see what to do. I'd also love to see Kenya Psychiatric Association also do the same, because I believe KMA may need to be collaboration with other associations and stakeholders alike to be able to make sure that all physicians in this country are well taken care of when it comes to mental health. Then maybe I'd want to just loop in our SG, Diana Marion, if she has one or two things she'd want to say, and then we can have the president wrap the session for us. So Diana Marion, welcome.
Thank you, Dr. Ida. Dr. Jackie has done justice to that topic. I think I would not want to add anything more. I'll just want to walk away with something, be joyful with small things. I don't know how easy that is for doctors, but that's a big one for me. And Dr. Kogo, thank you for the great moderation. Dr. Ida, you continue to do great things with your team in the Physician Wellness Committee. Let me say thank you. And for the attendees, thank you for being here and being able to participate in this. So I'll take this opportunity to thank everyone and welcome the President. Thank you to you, President.
Yeah, thank you very much to the whole team. And I think the psychiatrists have gone full circle, and they seem to be going back to the good old ways of the Africans, where the food was important, the socialization was important, the exercise was important. I think modern medicine is going back to the basics. With that said, I think it's important to stress that the physician well-being committee, KMA, as was stated, has what is called the Physician Wellbeing Committee, and maybe we would need to add on the part of the impaired physician that there are 3 ways of referring an impaired physician. The first one is self-referral, where a physician can declare themselves to be having issues, and KMA works very closely with the Kenya Psychiatric Association, where we link you up to the psychiatrist nearest to you. As you are aware, KMA has branches across the country, 19 and counting, And we have a network of physicians also via the Kenya Psychiatric Association where you can be referred. The second one is physicians referring other physicians. And this is where you say you are your brother's keeper. If you see that your colleagues require help, you can approach them, but you can also approach someone else to help them. And finally, there is the issue of involuntary treatment, so to speak, that has brought a bit of issues in the recent past. But I think these programs, Dr. Ida needs to put out some form of poster where people can feel safe to refer themselves. With that said, we want to thank Daktari for the great presentation and Dr. Kogo. Our Young Doctors Network are really taking us to the next level, and the whole KMA fraternity should continue giving us these great conversations. I really want to thank, I have seen some of my senior colleagues and teachers. Professor Adwok was on the call, and others. And we, as Kenya Medical Association, appreciate that we are able to touch base with everyone, from the very young to senior colleagues. With that, I want to thank all of you, and we'll see you in the next webinar.